Record high new cases the past 2 days, hospital cases on the up as well, 38 deaths so far this month. Well, joining me on the show is Professor Ooi Eng Eong from the Emerging Infectious Diseases Program at Duke-NUS Medical School. Welcome back to the show, Prof. So whether it's the numbers or how we've been managing this COVID-19 wave, what concerns you the most right now?
Well, I think the numbers don't tell the same story as it did last year. Obviously, vaccination has changed a lot of things. COVID-19 was a fearsome disease last year because many people who get it will go on to get severe COVID and then end up requiring oxygen and ICU care. But with vaccination, that has mostly been changed to mild flu-like illness, right? So the outcome of getting infection with SARS coronavirus 2 is very different this year compared to last year.
One of the big stories out today is that Pasir Panjang Wholesale Centre has reopened, but not before it went through the usual cycle of measures, shutting down and stepped up testing upon opening again. Prof, it's only a matter of time before a cluster pops up somewhere else, and that will trigger the whole closing, testing, opening process once more. What's your view on this particular measure?
A lot of the measures that we did last year, such as closing and then cleaning, deep cleaning and all that, and then restarting, isolating people who have had contact with cases, isolating people who are PCR positive but asymptomatic and all that, were really the reason why we did all that last year was because there was no other solution, right? So we had to prevent the virus from transmitting as much as we could. This year is very different because of two things. One is vaccination. That has changed the outcome, as I explained earlier, that majority of the cases now are very mild and no different from a common cold and other flu-like illnesses, right? So in terms of the impact of the disease is much lower. The second one, which also makes a big difference, is the Delta variant. The Delta variant is a lot more infectious, a lot more transmissible, but it doesn't seem to cause more severe disease. And because it is more transmissible, a lot of what worked last year, such as this closing down premises, deep clean and all that, do not work as well this year. And I think, from my perspective, I don't think it's necessary because now majority of the people in Singapore are also vaccinated. And so, the vaccination will protect us from getting the severe COVID, which is how we're going to have to live with this disease. I think the question that's facing Singapore is, can we continue on this path of, virus elimination? The answer is yes, we can. But it's going to come at a price, right? A big price, because Singapore's well-being or, the future thrives on a vibrant economy. In other words, people need to be able to move in and out of Singapore because that's how our economy is going to grow. So the question for Singapore really is, when do we open up? Right? It's not whether we should open up, but it's rather when we can open up. And sooner or later we have to. And when we open up, more and more Delta virus is going to come into Singapore. So either we accept it now, or we're going to say we're going to delay this and let it come later. But either way, it's going to come. From my perspective, actually, it is not a bad thing to let it happen sooner rather than later. The reason is we know Delta. We don't know all of it, but we know enough of Delta. It may change. By next year, it could be another virus that perhaps is even more transmissible than Delta. And then we will be opening up at a point where we have a lot of unknown to deal with.
Building on that, Prof, are you surprised by how long it's taking Singapore to learn to live with COVID-19? And are there any countries with a different approach to endemicity that we should be learning from?
I think, to me, it is not terribly surprising in the sense that it is hard. It is hard to let go when you were so successful last year, right? The success, of course, came at a big cost to Singapore. I mean, we had to mobilize our reserves. A lot of people's businesses were suffered. In terms of the success that we had last year, at some point we have to let it go if we're going to move on. And that's the hard part, to let go of a success, to go back and say, okay, now I'm going to start all over again. And I think that is not just for COVID, it applies for a lot of things. Whatever that we've been successful, we tend to hold on to it. And unfortunately, this is such a time where we have to let it go, and hopefully we'll get there.
Right. Well, Prof, on another subject or a related subject, so to speak, many of us thought, or to be more precise, hoped that vaccines were our ticket out of the pandemic. Do you think COVID-19 vaccines will get better, not just at preventing serious illness, but actual infection?
I don't think there is no vaccine that will prevent infection. I think that we should just set that aside. We're asking too much of both the vaccine and our immune system. Our immune system is not designed to prevent infection. It's designed to keep us well, to prevent against disease, right? So now the question is, are the mRNA vaccines, or the vaccines that are currently used in Singapore, are they good enough to prevent disease? The answer is yes, right? Because really the crux of the problem is when you have a lot of severe cases, then it occupies the healthcare infrastructure, it uses up beds and all that. And so patients with other conditions now do not have access to these beds and to the services. If we can keep that number within the manageable range, then there's no problem. So therefore, what we want to be able to move forward with is that, okay, we will be able to live with this virus, provided it doesn't make us so sick that we need to be in the hospital. Because we have lived with influenza, we have lived with dengue, we have lived with many other viruses that, such as hand, foot, and mouth disease and all that are potentially dangerous, but we don't go around shutting down societies just because there's a case of, dengue, or a case of influenza, or a case of hand, foot, and mouth, all the time. I think one of the hard things that conceptually difficult for people to accept is this idea that this is COVID-19, right? That there are 2,000 cases of COVID-19 in Singapore. I think that doesn't give the same, that doesn't convey the right message, because COVID-19 over the past 1.5 years have always struck fear in people. And so if you say there are 2,000 cases of COVID-19, naturally that will be fearsome, right? Whereas I think as I said earlier, the COVID-19 of last year isn't the COVID-19 of this year, especially amongst the vaccinated. Maybe it's time for us to differentiate and call it slightly, give it a different name. So for instance, I work on dengue, and in dengue, we split dengue into dengue with warning signs, and severe dengue. So it's not all dengue cases are the same, right? So you have the different categories, so that in each category, you manage them differently, right? So maybe it's time to have COVID-19 split into flu-like COVID-19, COVID-19 with warning signs, and severe COVID-19. So that the majority, the flu-like COVID-19, do not need to be hospitalized, do not need to be managed, and the patient may choose to self-medicate rather than even see a doctor. Whereas those with warning signs, then perhaps they ought to be admitted for observation, and certainly the severe COVID ought to be in the hospital because they will require oxygen. They may require intensive care. So if we split this, then it's not so alarming on both the patient as well as the public. When they see the numbers, they don't get shocked by the fact that there's 2,000 potentially lethal cases every day in Singapore. That's not the situation.